BSI. Before arriving on the scene, I'm making sure to have my appropriate PPE. I have my PPE. I've assessed the scene, and the scene is safe. Mechanism of injury is a motor vehicle crash. There's one patient, and there are bystanders. I'm going to be requesting ALS, fire department, police department, and rescue. I'm always considering C-spine stabilization. My general impression is that I have a middle-aged woman who appears to be an African-American woman who appears to be in her mid-50s. She's lying on her back in a supine position. She is not awake and appears to be unresponsive. Hello, ma'am, can you hear me? Hello, can you hear me? My patient is unresponsive to verbal stimuli. She is also unresponsive to painful stimuli, therefore she is unresponsive. I'm going to ask my ghost EMT to manually stabilize her spine. I'm going to check her airway. Airway is clear, but since she is unresponsive, I'm going to insert an oral airway adjunct. I'm going to measure from the side of her mouth to the tip of her ear. I'm going to turn it upside down, turn 180 degrees, and insert it. Checking for breathing, listening for breath sounds. Checking for any hissing or blood. Everything is clear. Patient is breathing adequately, but I am going to administer high concentration oxygen at a rate of 15 liters per minute through a non-rebreather mask after the assessment. Checking pulse. Pulse is strong and regular. Checking skin. Skin is warm and dry, and there are no signs of gross bleeding. But I am going to initiate shock treatment after this assessment. I'm going to cover her with a blanket to prevent any heat loss, and I've already administered oxygen at a rate of 15 liters per minute through a non-rebreather mask at a rate of 15 liters per minute. And my decision is that this is a high priority patient that needs to be transported. I stand by my request of ALS, fire department, police department, and rescue. I'm going to do my secondary head-to-toe assessment before we get onto the ambulance based on her condition, and then I finish everything else after. Okay. Starting with the head. Checking the scalp. Checking for decap BTLS. Everything is clear. Checking ears. Ears are clear, no CSF. Checking facial bones. Everything is clear. Checking mouth again. Clear. Checking nose again. Clear. Checking eyes. Eyes are good. Moving down to the neck. Checking for JVD. No JVD. No tracheal deviation. Checking spine. There are no medical tags. I'm asking my ghost EMT to put on a collar. Checking chest, palpating clavicle and sternum. Everything is clear. Checking for any trauma. Everything is clear. Everything's clear. Palpating abdomen, making sure that it's not tender or distended, it's soft. Checking pelvis. Pelvis is stable. There are no signs of incontinence or other fluids. Checking lower extremities. Checking for decap BTLS. Everything's clear. Palpating. Pulses are present and equal. Ma'am, can you push down for me? Can you push up for me? Which toe am I touching? Cannot assess motor and sensory function at this time because patient is unresponsive. Checking upper extremities. Checking for decap BTLS. Everything is clear. Checking pulse. Pulse is present and equal. Ma'am, can you push up for me, please? Can you push down for me, please? What finger am I touching? Cannot assess motor or sensory function at this time because patient is unresponsive. I'm now going to check her posterior thorax, buttocks, and lumbar region. I'm going to roll her towards me, keeping one hand on the shoulder, sweeping back, checking your DCAT, BTLS, checking buttocks, checking lumbar, everything's clear. I'm going to roll her down back onto a long spinal cord. She's going to be secured with appropriate straps and CID. She is now ready for transport. I'm asking anyone at the scene if anyone knows this woman. No one knows this woman, so I cannot assess for sample history at this time. So we're going to go. So on the ambulance, I'm going to ask my ghost EMT for vitals. Okay. Ghost EMT says BP is 100/70. Respirations are 10 per minute and labored. And pulse is 96. At this time, there are no secondary injuries that need to be treated. We are going to continue to the hospital, continuing high concentration oxygen administration at 15 liters per minute through the non-beat breather and continuing shock treatment. I'm going to reassess my patient every 5 minutes for vitals, interventions, chief complaint, airway, breathing, circulation, and mental status. Yes, reassessing every 5 minutes.